The mission of Babylon is to make healthcare accessible, affordable for every human being on earth. And that is equally true in New York, where half the population, unfortunately today, does not have a primary care physician. And without primary care, there really isn't care. You need a doctor that looks after you and is available to you all the time. And that is what we're going to bring to the citizens of the city. The right way to deal with healthcare is to give people a lot of healthcare upfront so they have less needs of crises and emergencies. What we are trying to do with Mount Sinai is to take all the services people need right to where they are, in their pocket, at their home, 24/7, so they can have a personal doctor available to them wherever they are, whenever they need it. But the problems with healthcare are often affordability and availability of clinical personnel. What we really need to do is serve each patient according to their needs. And if the best need is to see a nurse, if the best need is to talk to a chatbot to get the information they require, that's what they should do. Anybody who wishes to join us can. Their insurance should cover it. Most people will be eligible by their insurance to cover it, so they could do so for free or paid for by their insurance company. But those who don't have an insurance, we will make it incredibly affordable for them to pay for their own Babylon subscription. So now the job is to make sure that we make a great success of it. And our success is judged by how well the people like it. In the rest of the world where we operate, our patients, our customers, our members give us a net promoter score of 90 plus. We need to achieve the same in New York. When our members are happy, it shows we've done our job.
Sure. Mount Sinai Health Partners is a clinically integrated network that includes 4,000 physicians, and we manage 400,000 lives across varying lines of business: Medicare, Medicaid, commercial insurance, with a goal of improving the quality and reducing the total cost of care while enhancing the patient experience. Particularly in the time of COVID, we need to expand how we define delivery of care rather than just office-based as just one option, but now expanding into telemedicine and on-demand care. There's so many folks that have questions and a lot of fear out in the public. So if you're able to interact with somebody on demand when you need it, when you have that question or that first symptom, and be able to triage what's a serious symptom, what's not, what do I need, testing, not what kind of care, and making those decision points on the fly, I think not only does it give the customer, the patient, that peace of mind, but also helps use our valuable resources where it's needed the most. We value highly efficient care and impacting the upstream drivers of care, like social determinants, housing, food insecurity, and transportation, because we know those are of most importance to our patients. And so we drive to take a holistic approach to deal with those issues as well as the clinical concerns of our patients.
Well, Babylon is so much more than a telemedicine company. The mission of Babylon is to put healthcare in the hands of every person on earth. That means making healthcare affordable and accessible. That means today our services are covered by their insurance so that it's no cost to the people of New York who have access to these plans. First of all, what Babylon's app does is make it easy for people to access a medical team right through their phones. And that's wherever they are, whenever they need us. New Yorkers now have a new resource to access top-notch medical care from their homes 24/7. In the same way that we're all leaning on reaching out to our family members through our phones, it should be just as easy to reach out to a medical team right where you are, whenever you need it. People might know of Babylon's global reach as a cutting-edge healthcare technology firm, but what's most important is the human side of Babylon. We've put together a team of caring, compassionate primary care providers who are now accessible to New Yorkers 24/7, and that is what's most critical to offer New York during this crisis. In addition, there are amazing technological tools that are being deployed at the same time. So there's a symptom checker, there's access to a live chat feature, there are tools to help people monitor their symptoms at home, and lots of rich video content that helps translate medical advice into very digestible, accessible information. And so people get the right care in the right place at the right time.